Every one of you. Thank you very much. You're welcome to Institute of Living. This is basically our aim is to educate the public at large or the like we are to share our experiences overseas. And you're welcome to have a discussion with us, and that's very nice. Like I would like to give you a part of my experience regarding the healthcare delivery system in India at the moment with highly confused system at the moment. People do not know where to go and what to do. There are 1 million insurance companies all over, and they don't know what to do. Like poor people, they can't afford to have 2 slices of bread a day or a roti a day in India, can't afford to pay insurance. Not the government has thought about it. However, the below poverty line doesn't mean that that is the only thing. See now, because we have enough funds coming up from the overseas, or we have already introduced certain modalities. We have to change our way of thinking about managing the healthcare to the people. This can be done by the Digital India, one of the agenda currently going on. One can inculcate into this system the online consultation, video consultations, etc. You can, a part of it can go into that, and this is not very difficult. And these doctors can be included without discrimination with the private or the government systems of employment. This is not an employment. This is just a private business. Like they can participate. Like those who are wanting doctors who qualified the Medical Council of India to practice in India, they can work themselves, or they can work in the clinics or virtual clinics. Maybe this is very, very important. This is exactly what Australians have done. Just like Medicare system in Australia is doing very well. Everybody is being looked after by the Medicare system. What this system does, like out of the hospital, a patient goes to a doctor and he looks at the patient, say a first visit, and then followed by visit go to specialist if necessary. And the first visit, it will be thoroughly checked, everything. There are programs which has been launched in that country, and one wishes to go into that is excellent. Instead of going straight away into like a tertiary hospital, you have like primary care physicians or general practitioners in India can take it up as well as a task at large. Instead of going for alternative medicine straight away, the patients can first filter with these doctors. If they wish, they can go, because it's very difficult to find everybody. See, it's only the medical qualified doctors can do this as a primary care, whatever it is, with a special interest in, say they have surgery, etc., blah, blah, blah. They can also have their clients through the net. They can get the net, like virtual practice on net and also follow up on it. This is easily available, and we have a system for this. I have a system for this I've developed, and also continuing professional development or continuing medical education I'm working on. Probably this will fit into that. What I appreciate would be like this can be made to a certain amount to the public, where they can utilize these services online on their mobile phones and interact with the doctors positively. And this needs to be like, when they do this sort of a thing. I'll come out of my ideas, but as a public, if one has the funding by the government as a fee for service, each time you can visit any doctor anytime, visit to wait and see if he's on the queue, then obviously everybody works, and patient will be happy. And also the medication it gets need to be authorized by the doctor. That's very important. And also follow-up need to be done, and also day-to-day follow-up, and of course regular follow-up. It's very important, like chronic disorders, chronic disease management. Like many of these chronic diseases can be, gathered, and they can be put into these program, like chronic diseases, like diabetes, hypertension, like you've got psychiatric disorders, arthritis, bone joint, etc. These are some of these chronic disorders need to be monitored by more than one person. Then a given doctor need have the protocol for the job to be done, and also a payment for the same. Like this is very important. Each second, each minute the doctor spends, the restricted time for each of them, and he has to finish his job with the patient to keep up the pace. So the number of patients we have ordered large, and this is what is required today for the preventive medicine. For example, a check at 40 requires stop smoking, blood checkup. If he's having alcohol problems, you've got other problems, stress, appropriate referral agencies are there. This can be done by the primary care physician, and from there you take off. And this is very much the requirement today. You can filter almost 75% of the patients. Only those who require specialized treatment, maybe 5 to 10%, may be referred by this doctor to those things. And also other things, so these consultations need to be paid one-on-one basis, and this can be collected by the doctor with a number, and the money can be transferred directly from the fund into the doctor's fee straight away. And at the straight regular intervals, say weekly, that motivates the doctor to work harder and reach people much more easily than otherwise. See, this is what is motivating factors for doctors in the country like Australia. What I know, it is very, very effective. Very effective. Take it for granted. So why I take it from here is to wake up earlier. When you started the Digital India, you include into it and see. You can take it from here. So basically, Medicare India is the word I would like to use, and also and continuum of the care is very important also. Once you did the continuum of the care, this is very effective in monitoring and following up the patients. So this gives a satisfactory results in the long term, and a success to the healthcare. That's a problem and solution. That's it. Otherwise, you get nothing comes for free. And that's what I will say. Thank you.